Good evening, sir.
Good evening.
So, your name, designation, and your organization's name for the camera, please.
So, I am Dr. Aashish Chaudhry. I am the Managing Director of Aakash Healthcare Super Specialty Hospital, Dwarka, and a practicing orthopedic surgeon as well.
Thank you, sir. So my first question is that how is this event going on for you, sir?
Well, I have been here for last few hours, and I have been a part of the panel on discussion on leadership lessons from the CEO perspective. It has been a great panel discussion. A lot of stalwarts from the healthcare industry were there, and we were able to exchange notes on how a clinician gets transforming into an admin role, and how does it strikes a balance among both the roles, whether it is a healthcare or clinical oriented versus the admin role, and what is the importance of funding, corporate governance, and hiring a professional CXO team. So those aspects were discussed. I had a lot of learnings from the panel.
Thank you, sir. So since budget for this coming financial year 2026 is being announced day after, I have a question for you based on that.
Sure.
So what expectations do stakeholders have from this coming budget regarding increased funding for healthcare infrastructure and workforce development?
So all these years, we have been always trying to portray that there has to be a more focus on healthcare funding as far as the percentage of GDP is concerned. But there are micro issues and more focused healthcare issues where we should focus on nurturing healthcare talent within the country, because though the country is very large, the doctor-patient proportion is still very awkward and uncomparable to the Western world. We need to focus on skill development. Government has laid out a lot of programs for skill development, reaching out to tier 2 and 3 and 4 cities and trying to bring that talent, and also have an equitable distribution of healthcare across various cities, not just in the metros. Apart from that, there is one particular issue we have been raising every year, that's the GST reversal, which doesn't happen in healthcare. So it ultimately, the cost of that GST reversal not happening is borne by the patient. So somewhere, if government thinks seriously on that reversal, it's going to bring down the cost of for the end user, that's the patient and the attendants. And more so, one has to focus more on the preventive aspect, because what government is, most of the initiatives are to bring about technology, manpower, infrastructure, building hospitals for the treatments. But what about the preventive space, wherein we can save lots and thousands of dollars if we try and arrest the disease early on, try to diagnose it and treat it even before it becomes into a complicated disease. So that's one aspect government should seriously focus and try and direct the healthcare funding in the preventive and wellness space.
Thank you, sir. That's all.